Okay, good day to everyone. Johnny Balmeo here. So last time, naputol ang discussion natin. We weren't able to finish itong mga topics na to. So for today, I'll try to cover all these topics. We have the PIH, the oligo and polyhydramnios, ano pa ba? The postterm pregnancy, the preterm labor, the IUFD or the intrauterine fetal death. And last, for the RH incompatibility, I'll just create a separate one para mas maging madali ang explanation ko sa inyo for the RH incompatibility because RH incompatibility is very important topic. Okay, so without further ado, let's continue this one. We have here the pregnancy-induced hypertension or simply as the PIH. So ano po ba itong PIH na to? Well, familiar kayo rito kasi sometimes we call it preeclampsia. Pero huwag kayo malilito because in some other books, the PIH or the pregnancy-induced hypertension is actually an umbrella term. Meaning to say, ito si PIH, nasa baba niya, eclampsia. Ang pinaka-severe form niya, eclampsia. Okay? We have the preeclampsia, eclampsia. Then, ang pinaka-complication niya is what we call the HELP syndrome. At yun ang pag-uusapan natin ngayon. Okay? So, for the pregnancy-induced hypertension or the PIH, from the name itself, kaya lang nagkakaroon ng hypertension si mother kapag ka po nagkaroon ng pagbubuntis. Okay? So, this is a form of increased blood pressure during pregnancy. Sometimes we call it the toxemia or preeclampsia. And also, the severe form ng PIH natin is the eclampsia in which may kasama na itong seizure. Okay? And then, as I mentioned kanina, we have the complication known as what? The HELP syndrome. Okay, madaling tandaan ito. When we say HELP syndrome, sir, ano po ba to? Tandaan nyo lamang yung ating mnemonic dito. HELP. HELP stands for hemolysis, elevated liver enzymes, and also low platelet count or simply as the HELP syndrome. So, ito po yung nangyayari kapag ang patient natin is merong preeclampsia or eclampsia. Okay, ito yung pinaka-complication natin. Medyo delikado na kapag ang pasyente natin is nauwi sa HELP syndrome. So, just a little information guys, para mas madali natin itong matandaan. Okay, kapag merong PIH, nagkakaroon tayo ng vasospasm. If you have a vasospasm, it has a direct effect to the vascular effects, to the vascular, to the kidney, and also into the interstitial space. So, unahin natin ito. Nagkakaroon ng vascular effect. In what way? Ang blood vessels natin, okay, kapag karoon ng vasospasm, okay, magkakaroon po ng constriction, liliit, known as the vasoconstrictions. If that thing happen, magkakaroon ng poor organ perfusion leading to what? Increased blood pressure. Okay? Tataas ang BP. And of course, kapag nangyari yan, there's also a high chance na maapektuhan na to yung different tissues ng katawan, especially kung buntis ka, yung fetus. What else? Sa may kidney, meron din itong direct effect, katulad ng it may decrease the glomeruli, the glomerular filtration rate, and also it can increase the permeability of the glomeruli membranes. So yung dati na panala, kay maliliit lang yung mga butas niya, so hindi pumapasok doon yung malalaking mga molecules or particles, katulad ng the protein, the BUN, okay, the crea is also normal. But, okay, kapag nagkaroon ng vasospasm, it has a direct effect to the kidney, it may alter the kidney functions. So, kung pwedeng makalusot dyan, yung protein, kung pwedeng makalusot dyan, yung BUN, known as the blood, urine, nitrogen, and pwede rin makalusot dyan, uric acid. And of course, kapag nangyari yan sa may kidney, okay, lalabas dito yung pagtaas ng creatinine, leading to what? Decreased urine output and of course, proteinuria. Okay, another one, we have the interstitial effect. Ano po ba nangyayari rito? Well, kapag tumaas or nagkakaroon ng vasospasm, yung blood natin doon sa may ugat, nagkakaroon po ng diffusion effect. Saan na po nangyayari ron? Yung fluid na nanduroon sa may ugat, lumalabas. Sir, saan na pupunta? Sa may interstitial space. Pag lumabas yung fluid na yon, palabas dun sa may ugat, it may lead to what? Edema, manas. Okay, so para mas madali natin tandaan, okay, I use this diagram. Okay, next. Ano po ba yung mga signs and symptoms ng HELP syndrome? Number one, there will be a breakdown of RBC or the red blood cell. Sir, bakit po? As I've mentioned to you kanina, nagkakaroon tayo dito ng hemolysis. Nagkakaroon ng breakdown dun sa may RBC or your red blood cell is what? Namamatay, nasisira. Okay, another one is changes in the liver. Lumalaki po yung liver. Okay? Lumalaki or tumataba. Sir, bakit po? Because yung daluyan ng ugat dun sa may liver is also, can I say this one, being blocked. Okay? Being blocked. Okay, so nahihirapan ngayon itong liver na to. If that thing happen, pwedeng tumaas dito yung liver enzymes. So kung babalikan natin yung mnemonics natin, makikita nyo rito, elevated liver enzymes. Okay, what else? Bumababa rin ang platelet count. Okay, bumababa po ang platelet count. Mapapansin nyo rito, ayun, low platelet count. Okay, why? Because cells found in the blood that are needed to help the blood to clot in order to control bleeding is being what? Okay, being hemolyzed or nasisira. Okay, so kasamang namamatay na ito is what? The platelets. Okay, next. There are 3 primary characteristics na pwede po natin makita sa may health syndrome. Number 1, may pagtaas ng blood pressure. Usually, 140 over 90 mm mercury yung BP, or po pwede rin naman either of the two. Okay, po pwedeng systolic or diastolic ang tumaas. Or po pwedeng both. Okay, what else? Protein in the urine known as the proteinuria, and of course, edema or manas. Okay, so kung mapapansin ninyo, sir, parang yan din po yung nakikita natin sa may pre-eclampsia at saka eclampsia. Answer is yes. Okay, so the main cause kung bakit po nagkakaroon ng PIH, at the same time, health syndrome ng pasyente is still unknown. But there are some predisposing factors katulad ng nagkaroon ka na or meron kang hypertension. Okay, sa may pagbubuntis mo. Ano pa? Meron ka ng problema sa may kidney mo para sa may napag-usapan natin last time, right? Kung maalala ninyo, sa may CKD, okay, the chronic kidney disease, okay, it may predispose. What else? If you have a diabetes, alam naman natin, this is a chronic disease, it has a domino effect to our body. Okay, ano pa? Multiple gestation, katulad ng twins or triplets, etc. Okay, it may predispose the PIH. Also, nagkaroon ka na dati ng PIH. So, sa second pregnancy, third pregnancy, pwede pong uling maulit yan. And of course, the mother ages younger than 20 or kaya naman older than 40. Okay? So, just a little note, PIH should be treated immediately. So, kapag nalaman natin na ang pasyente natin is mayroong PIH or pregnancy-induced hypertension, we need to treat our patient because there's a possibility na tataas at tataas ang BP niyan, leading to what? Okay? Resistance of the blood vessels. Okay, an increase in the resistance of the blood vessels. It may also hinder the blood flow. Okay, what if? Okay, what if yung blood flow is it occluded or it can I say this one? It occluded or hinder or kaya naman nagkaroon ng bara dun sa may ugat papunta rin kay baby, the umbilical cord. So pwedeng ikamatay ito ng baby. So there are other problems katulad ng placental abruptio or abruptio placenta. Okay, what else? Fetal problems such as growth restrictions. So, hindi pa nisisilang si baby yung growth niya, okay? Nag-stop na. Okay, so magkakaroon tayo dito ng poor fetal growth, and worse is stillbirth. Okay, pwede pong ikamatay rin ito ng baby. Other signs and symptoms na pwede natin makita sa pasyente natin who is having a PIH or HELLP syndrome. Okay, of course, mayroong pagtaas ng BP. Okay. Sa may kidney naman, magkakaroon ng proteinuria. Sa mga limbs, sa may extremities, pwede magkaroon ng edema o pwede po sa may mukha. Okay, sudden weight gain, yes po pwede pong magkaroon ng weight gain din ng patient natin. Sudden, okay, because, ayun nga, kung napansin ninyo, nagkaroon ng edema. Ano pa? Blurring or double vision kasi tumataas ng pressure sa may katawan because of the hypertension. Nausea and vomiting, meaning to say affected na po yung utak. Okay, what else? Hypertension din. Ano pa? Right-sided upper abdominal pain or pain around the stomach. Sir, bakit po? Okay, kasi nagkakaroon na ng problema dun sa may kidney. Lumalaki yung kidney. Nako-compress. Kaya minsan sumasakit right-sided. Ano pa? Pwede ring humina or mawala ang urine output. Okay, so there will be a decrease in the urine output and also changes in the liver or kidney function tests. So kung mapapansin natin dito, sa pasyente natin, mataas dito ang liver enzymes niya, the SGOT, SGPT, or the LT and AST. Sa may kidney naman, tumataas din dito ang creatinine. Kapag nakita natin yung mga laboratories na yun sa may patient natin na mayroong PIH or the HELLP syndrome, delikado. Okay, delikado na po ang mother. Okay, so some diagnostic, pwede natin i-check yung kanilang BP. Sa may BP niya, malalaman natin kung tumataas ba yung BP niya. Regular ba na tumataas or baka naman ngayon lang. Urine testing para malaman natin if the patient is suffering from proteinuria. Okay, pwede rin natin i-assess ang edema. Okay, kung gaano kalala. Kasi meron tayong tinatawag na pitting edema scale para malaman natin kung gaano na kalaki or kalala yung edema na meron siya. Okay, frequent weight measurement kasi nga there's a tendency na bigla na lang mag-increase ang weight ng mother. Eye examination para ma-check natin kapag nagkakaroon ng retinal changes or kaya naman double vision. Okay, liver and kidney function test katulad ng CREA, the BUN, the SGOT and SGPT, and of course, the blood clotting test kasi bumababa ang platelet ng patient natin. So ano po ang treatment natin dito? Of course, kapag ang pasyente natin is merong PIH, bed rest lang muna. Okay? Pwedeng bed rest lang muna yan. Ngayon, kung medyo malala na yan, we can send our patient to the hospital at dun sa may hospital siya, imo-monitor. Okay, what else? Of course, the drug of choice is the magnesium sulfate. So alam naman natin ito, familiar na familiar tayo with the magnesium sulfate. Okay, this is actually a CNS depressant and at the same time, anti-convulsive drug. Okay, so ang ano natin dito, ang route natin dito, it can be given via IM or IV. Okay, so it is being given for the first dose immediately, but for the second dose, be careful. There are many things that we need to check. Okay, so for the first dose, we can give this one via IV, while for the second dose, we can give this one via buttocks. Okay, sa may puwet. So some nursing considerations. Before giving these medications, consider muna natin the right in giving medications. Okay, the 10 rights. If your school is using the 12 rights, well, yun ang susundin natin, okay? Check also for the expiration date of the medication. Baka naman expire na yung bibigay mo. Okay, check for the proper color of the medication. Translucent white or transparent white. Kapag nagkaroon ng bagong kulay niya, naging yellow, naging brown, delikado na po yun. Okay? And also check for the proper color of the medication. Ano pa ba? Check the patient's BP before and after giving of the medication. Baka magbibigay na ito kung mababa naman yung BP ng patient natin. Okay? And also, insert Foley catheter as per doctor's order. Okay? So, lagi naman pong nagbibigay tayo ng Foley cat kapag nagbibigay tayo ng magso. So, there are many reasons behind that kung bakit po tayo nag-insert ng Foley catheter. But the number one rationale why we are inserting Foley cat after giving the magso is for us to measure the urine output. Okay? Kasi dun din sa may urine output natin mame-measure if the patient is suffering from what? Toxicity. Okay? So, before giving the second dose, there are many things that we need to check. As I mentioned to you, the blood pressure. Meron pagtaas ba? Pagbaba? What else? Urine output. Kapag ang urine output ng patient natin is mas mababa than 30 cc per hour, okay, hold muna natin yung second dose and then i-document natin yan doon sa may chart and then we have to phone our patient, the doctor. Tawagan natin si doc and notify natin regarding doon sa may naging findings natin. And then si doc ang magdi-decide, are we going to continue the magnesium sulfate or no? What else? As you can see here, ayan, check for the knee jerk. Okay, kung positive or negative. Okay, check natin yan. If negative, i-hold natin ang ating magso and then i-notify natin si doc. Okay, ni doc, for the knee jerk, okay, there is a negative sign for the knee jerk. Okay, negative po ang knee jerk natin. What should we do, doc? So the doc will tell you, hold muna natin. Okay, and then pakiready na rito yung ating antidote, which is what? Naalala pa, gagamitin natin the drug on hand. Drug on hand all the time kapag nagbibigay tayo ng magso. Ano yun? Naalala pa, guys? Yes, the calcium gluconate. What else? We need also to perform fetal monitoring kasi ang baby natin dito is what? Under distress. Okay, so we need to check kung okay pa ba si baby. Okay, some factors that we need to include. Okay, the fetal movement counting, minimeasure din natin yan para malaman natin if the baby is having a fetal distress. Ano pa? Non-stress test. Or should I say non-stress testing test. Ang ginagawa ito, check natin kung nagre-respond ba, okay, yung fetus. Nagre-respond ba doon sa may movement. Also, biophysical profile. Okay? The test that combine non-stress test and also the ultrasound para ma-observe natin kamusta ang baby doon sa may loob ng womb ni mother. And also, Doppler waves para ma-measure natin the flow of the blood through the blood vessels. Okay? Okay pa ba ang daluyan ng ugat? Daluyan sa ugat. Okay? Normal pa ba yung flow ng dugo? Okay? Wala bang pagbabara? Okay, so that's why it's very important to have the Doppler waves. So continued laboratory testing lang din tayo for the urine and the blood para malaman natin meron bang pagbabago. Okay, medications katulad ng corticosteroid, nakakatulong naman siya. Okay, sa may baby para mas mag-mature yung lungs nila. Para sa ganun, if ever na kailangan ng ilabas si baby, okay, kaya na niya mag-survive. Okay? So for the delivery of the baby, if the treatment do not control the PIH, hindi kaya ng medications. And also, if the fetus or the mother is in danger, mamimili tayo dyan, okay? On hold muna natin ang delivery or we're going to what? okay, start the delivery na. Okay, usually CS, ito ang nire-recommend natin. Now, for the general nursing care, always remember our acronym, PEACE. Okay, this is a good management actually. P stands for promote bed rest. E for what? Ensure high protein intake. A for antihypertensive drug, katulad ng hydralazine. Okay, in-highlight ko to na color red because hydralazine, be careful in giving these medications. For what reason? Because this is a pregnancy category C. Okay, so ingat-ingat. CNS depressant, katulad ng Magso, okay, kailangan on hand po ito. If ever na pasyente natin is mag-undergo ng seizure. Okay, tsaka para makontrol na rin natin at the same time yung blood pressure ng pasyente natin. Okay, then evaluate natin physical parameters for the magnesium sulfate toxicity. Tandaan natin, burp. Okay, ito yung titingnan natin, burp. Okay, meron bang pagbaba ng BP? Okay, kung bumaba ang BP, huwag ka na magbigay ng Magso. Okay, ang urine output po ba is bumaba? Okay, decrease. Huwag ka muna magbibigay. There's a possibility for toxicity. Ganon din sa respiratory rate. Kapag ang RR natin is less than 12 minutes. Lastly, patellar reflex is what? Absent. The knee jerk is absent. So, pagka ganyan na nakita natin, on hold muna natin ang medication. Huwag natin ibibigay. Okay? Next, okay, some helpful syndrome treatment. There are those times na pinaparedy na rin po sa atin itong blood transfusion because as I've mentioned to you, ang pasyente na mayroong HELLP syndrome, they have a hemolysis. Okay, so nangangailangan sila dyan ng dugo. So, i-ready na rin natin yan. Okay, usually in order naman ni Doc yan to ready the BT or the blood transfusion. And then bed rest ang pasyente natin, then monitor lang natin si baby. Okay, continuous monitoring of mom and baby. Nang sa ganun, makita natin okay pa ba si mother and okay pa ba si baby. Okay, and then on hold po ay on hand natin parate si Magso if ever na mayroong mangyaring masama kay mother katulad ng pagsi-seizure, hindi natin makontrol ang convulsion. Okay? And then also blood pressure medication, paki-ready na rin to katulad ng sinabi ko sa inyo kanina, hydralazine. But be careful be careful in using the hydralazine. And then corticosteroid para kay baby nang sa ganon, mas mag-mature yung kanyang lungs. Para kung kinakailangan ilabas na si baby, kay paglabas niya, he or she is what? Okay, matured yung lungs niya, matured enough to survive. Okay, so Q&A tayo. Your patient is in the gynae ward and had developed a severe preeclampsia. So what would be the drug you would expect to administer? So are we going to administer a loop diuretics, an NSAIDs, or an etidine? Okay, are we going to give this one? Did I mention that to my discussion? Hindi, right? Okay, so of course it is what? Magnesium sulfate. Another one, kung nakikinig ka ba? Kung oo, what is HELLP syndrome? Okay, ano po ba itong HELLP syndrome na ito? Okay, sabi sa letter D, all answers are correct. Lahat daw ito tama. Totoo kaya yun? Tingnan natin. A life-threatening condition. Is it a life-threatening condition? How about letter B? A hypertensive disorder of pregnancy. Pwede. Okay, how about letter C? A condition involving H for hemolysis, EL for elevated liver enzymes, and P for what? Low platelet count. Okay. Teka. Yeah, tama. Low platelet count. Okay. So what is your question? What is your answer here? Okay, anyone? Sanay ako na online. Naka-record nga pala to. Okay, so what is the answer for this one? It's letter D. Okay, all answers are correct. How about this one? Ito, sige nga, subukan mo sagutin. What is preeclampsia? Okay. Is it a life-threatening condition? Is it a hypertensive disorder of pregnancy? Or it is a seizure during pregnancy? Okay, what is your answer? The answer is what? I think natanong ko na sa inyo to, right? Okay? Sige, hindi ko ito sasagutin. Okay, sa hindi pa nakakaalam, try to rationalize. Okay? Bakit ba sinasabi yung sagot? Kasi, okay, try to rationalize. Okay? Ang pinag-uusapan natin dito is only preeclampsia. Ang preeclampsia ba, meron po bang seizure na nangyayari dito? Okay? Sir, is it really a life-threatening condition? Or maybe it is just a hypertensive disorder of pregnancy. Okay? Try to analyze the question. Okay? So ngayon, hindi ko muna sasabihin yung sagot. So that is the end of the session 2. Meron pa tayong another session. So we will now move on to the new discussion, which is what? The oligohydramnios. Okay? So from the name itself, oligo, meaning to say there's a scanty or lack, meaning may kulang. Okay? And then hydramnios, ano po ba yan? This is what? The amniotic fluid. So when we say oligohydramnios, it refers to the pregnancy with less than, okay, the average amount of the amniotic fluid. Nagkukulang ang kanyang panubigan o yung tubig. Okay, kulang. So delikado po ba yan? Delikado yan, of course. Okay? Sir, ano po ba nangyayari? Bakit po nangyayari itong oligohydramnios? There are many factors that we need to consider. Katulad ng okay, some part of the volume the amniotic fluid is usually being formed by the addition of the fetal urine. Okay, yung iniihi ng baby. So, kapag may problema ang baby, okay, problem sa may digestion niya, sa may mouth niya, or kaya dun sa kanyang excretion ng waste, katulad ng urine. Kapag may problema siya, pwedeng humina or bumaba ang ating amniotic fluid. Okay? What else? Another cause is due to growth restriction of the fetus. Okay? He or she is not voiding as much as usual. Hindi na niya kayang umihi. Okay? So, less na yun ipoproduce dito na amniotic fluid. What else? Masyadong compressed si baby. Okay? Masyado na siya nako-compress. Okay? Hindi na siya magkasya dito sa ating uterus. Okay, so what do you think might gonna happen? Okay, may hirapan si baby na umihi. Okay, so for the production of the amniotic fluid, malalasan. There are diagnosis na pwede nating makakuha, katulad na physical assessment. Sa physical assessment, makikita mo kagad, inspection. Okay, suspected during pregnancy if the uterus fails to meet its expected growth rate. Okay, ano pa ba? We can also perform ultrasound. So may ultrasound, makikita kagad natin na kulang na kulang talaga ang amniotic fluid. Okay, makikita kagad natin dito. So, ano po ba ang epekto nato sa may fetus after birth? Pagka pinanganak si baby, meron po ba? Yes. Katulad ng muscle weakness. Bakit? Kasi, na-compress siya dun sa may loob ng amniotic sac, or should I say the uterus. Na-compress siya. Okay, hindi siya masyado nakakagalaw. Ano pa? Lung fails to develop, that can lead to what? Hypoplastic lungs, which means nagkakaroon ng difficulty of breathing po si fetus. Okay? What else? The Potter syndrome. Okay, ito yung pinaka-common na pwede ninyo makita sa pasyente natin na na pinanganak from the oligohydramnios. Okay, Potter syndrome. Meaning to say there are some distortion. Okay? Let me show you a picture. Yan, parang ganyan. Okay? Nagbabago yung itsura nila. Distorted yung physical appearance. Okay? The extremities and even the face. Yan, as you can see here. Distorted po yung katawan. Bakit? Kasi na-compress sila okay, during the intrauterine, should I say, pregnancy. Okay, during the pregnancy, okay, sa may uterus, okay, na-compress sila. Kaya nagbago yung itsura, physique. Okay? So, some nursing considerations that we need to understand here, we need to careful inspection among infants at birth para ma-rule out kagad natin dito kung meron po bang kidney disease si baby. Okay, next naman na pag-usapan natin dito is the polyhydramnios. So, poly meaning to say excessive or more than. Kabaliktaran naman po ito ng oligohydramnios, in which may oligo, merong scanty or kulang, pagkukulang. Here naman sa may polyhydramnios, more than or sobra. Okay, so it occurs when there is an excessive fluid of more than 2,000 ml or an amniotic fluid index above 24 cm. Masyadong mataas. Okay? And also, the production of the amniotic fluid is masyadong malakas. So, ang effect nato sa may pagbubuntis or dun sa may baby is what? It can cause malpresentation. So, ang baby dapat nauuna na yung ulo eh. Kaso nga lang, since marami amniotic fluid, free-floating ang baby. She is floating, okay, in the amniotic sac. So, ang pwedeng mangyari dyan, yung ulo nakababa na, nagbago pa, naging transverse pa ang presentation ni baby. Naging transverse lie. Okay, possible po ba yun? Yes, possible yun. What else? It can also lead to premature rupture of the membrane. Okay, and what else? It can lead to what? Risk for infection, prolapse cord po pwede rin magkaroon ng preterm birth. Okay, so what else? Some causes of the polygohydramnios. Okay, there's a possibility na yung fetus is what? Hindi siya makapag-swallow or hindi siya makapag-absorb ng fluid at hindi niya naiihi rin. Okay, so there are some causes kung bakit hindi nakapag-swallow ng fluid si baby o pwedeng anencephaly. Okay, ano po yan? Ito yung itsura niyan. Okay, nawawala yung cranium. Exposed po ba yung utak? Yes, that is what happened to the anencephaly. Po pwede rin naman na yung fetus is what? Merong tracheoesophageal fistula. Po pwede rin merong stenosis. Okay, so nahihirapan talaga siya to absorb the amniotic fluid or ilunon. Okay, what else? Fetus with intestinal obstruction. Okay, kahit nalunon siya ng lunon, naiipon lamang doon. Okay, sa may GI niya. Okay, for what reason? Obstructed, barado. Okay, what else? It occurs among infant with a diabetic mother. Kaya ang buntis, kaya delikado yan kapag merong diabetes mellitus. That's why we really need to control those. Prevention is better than cure, ika nga. Okay, so ano yung pwede natin makita rito? Okay, assessment natin. Physically, there's a rapid enlargement of the uterus. Biglaan yung paglaki ng uterus or ng womb. Okay, kasi nagkakaroon ng overproduction ng amniotic fluid. Ano pa? Difficulty to palpate the fetal parts. Ang hirap ipalpate. For what reason? Kasi nung pala ang presentation ng baby is not cephalic. Instead, what? Transverse. Okay, so ang hirap talagang ipalpate yung fetal part. Ano pa? Difficulty in sculpting the FHR. Hindi mo masyadong marinig or mahina yung fetal heart tone. Okay, the FHT. For what reason? Kasi nga ang daming fluid. So nahihinder yung sound. Okay, na napoproduce ng heart ni baby. Ano pa? Women may have extreme shortness of breath. Nahihirapang huminga. For what reason? Kasi nakakompress yung kanyang lungs dahil sa pagtaas ng fundus. Okay, ano pa? Okay, presence of varicosities and hemorrhoids. So, bakit po nagkakaroon ng varicosities and hemorrhoids? Okay, though talagang nakikita natin ito sa mga ibang mga buntis, pero factor din kasi rito yung oligohydramnios or the polyhydramnios, Okay? Bakit? Nagkakaroon tayo dito kasi ng venous return. Nahihirapan na bumalik yung dugo kay pabalik sa may puso. So, nangyari na iipon doon. Okay? Sa may lower extremities at the same time, doon sa may, what do you call this one? Sa may gawing putan. Kaya nagkakaroon ng hemorrhoids. Ano pa? Increased weight gain. Okay, kasi nga sobrang production ng amniotic fluid and of course, using the ultrasound, it will confirm. Malalaman natin, makikita natin sa may ultrasound that there's really a problem with the production of the amniotic fluid. That's why it's a good test to confirm if our patient is having an polyhydramnios or oligohydramnios. Okay, what else? Saan ba? Okay, so therapeutic management for the polyhydramnios, we have hospitalization or home care. If our patient has a polyhydramnios, we can advise the women to have a rest. Ano pa? For further evaluation. Kasi nga pwedeng malagay rito sa panganib yung baby. So we need to evaluate not only the mother but also the baby. So kailangan meron sa atin or sa inyo na merong alam, okay, sa may community na how to evaluate the mother regarding this situation. Okay, hindi pa pwede kasi na bed rest ka lang hanggang sa mga anak ka. Hindi mo alam, patay na pala yung fetus, right? Okay, what else? We also have to maintain the adequate utero-placental circulation. Okay, and also reduce the pressure on the cervix and prevents preterm labor. Kaya nga, ang ganda rito is what? Bed rest muna, higa lang muna si mother. Okay? So we have to advise the woman to report any signs. Baka meron siyang nararamdaman na masakit sa kanya or kaya naman merong scanty blood or tinatawag nating spotting. Okay, what else? Nagkakaroon ng contractions. Delikado na yun. Baka nagkakaroon tayo dito ng preterm labor. Kaya ano pa? Advise the women to have high fiber diet. Okay, kailangan maganda yung diet ng pasyente natin dito. Sa ganun, makontrol pa rin natin yung blood pressure. Okay? Monitor vital signs in the hospital. Napaka-importante niyan. Okay, because it may reveal us some information to our client kung nagdidelikado na ba. Monitor din natin yung presence ng edema, lalo na sa may lower extremities. Kasi hindi umaakit, kaya walang venous return na nangyayari. And of course, we can perform amniocentesis. Okay, in the amniocentesis, it will remove the some of the excess fluid. Okay, tatanggalin yan, i-aspirate yan using the amniocentesis. And we can also give tocolytics. So, para saan po itong tocolytics na to? The tocolytics actually prevent or it can stop the preterm labor. Okay, so kung hindi mo pa kabuanan, we can use tocolytics. Okay, so at least, mapapatagal pa rin natin yung pregnancy mo. So, si baby, pag lumabas, okay, sa may kabuanan mo na, or at least, matured na yung kanyang lungs. Okay, so don't forget, tocolytics. If preterm rupture of the membrane naman, nag-occur, membranes can be needled actually. Pwede natin yung sundutin eh. Okay? Pwede natin gawin ito, or kaya naman si OB, by doing that, okay, it will slow or control the release of fluid and also it may prevent prolapse cord during the labor. Sir, paano po ba ginagawa dyan? Okay? Hindi pala rito nakalagay. Sorry. Hindi pala nakalagay dito yung picture. Anyways, we also have to assess the infant after birth for what? GI blockage. Kaya pala nagkakaroon ng polyhydramnios is because meron palang problema si baby sa GI niya. Okay, lulun siya ng lulun, hindi naman na niya kaya. Okay, I mean the fetus. So, basic knowledge tayo. A fetus is what? A, develops in the uterus. Okay, or letter B, it is surrounded by amniotic fluid. Amniotic fluid, I mean. Okay? Or letter C, it is enveloped inside the amniotic sac. Okay, so what is your answer? Or is it letter D? All answers are correct. Okay, so ikaw bahala mag-rationalize. Madaling-madali lang yan. Another one. How about this? Which is not, tandaan ang tinatanong dito which is not a function of the amniotic fluid? Okay, simulan ko kay letter D. To provide the fetus with nutrients. Is that true? Okay, tandaan natin ito. Ang hinanap natin dito is not. Okay, how about letter C? It protects the fetus from blows. Okay, how about letter B? To keep fragile, growing body parts lubricated. Pwede. How about letter A? To help practice using the digestive system and aids in its development. Okay, so bahala ka. Ikaw nakakaalam dito. Try to rationalize. What is the answer for this one? Okay, next we have here a postterm pregnancy. So from the name itself, postterm, after the term. So ano po ba yung term pregnancy? Okay, the term pregnancy ranges from 38 weeks to 42 weeks. Okay, yan yung fully term natin. Pero beyond that one can be considered as what? Postterm pregnancy. Okay, tandaan natin according to the book, the postterm pregnancy is any pregnancy that extends this period. Okay, 38 to 42 weeks is our term. So meaning to say 42, beyond that, okay, postterm pregnancy po yun. So there are many causes why it happened, pero ang nanguna rito is that women who have a long menstrual cycle. So ganun pala, there's a possibility pala, yes, because it has something to do with the hormone, okay, ng isang babae. Okay, what else? Okay, women who are receiving a high dose of salicylates, habang nagbubuntis po siya, nagtitake siya ng mga pain reliever, katulad ng aspirin. Okay, what else? Para makontrol ang kanyang headache, or kaya naman kung meron siyang rheumatoid arthritis. Because of what? It can interfere with the hormone known as what? The prostaglandin. Okay, it interferes with the synthesis of the prostaglandin, leading to what? Postterm pregnancy. Ano pa? Myometrial quiescence. Okay, ano po ba to? These are actually uterus that does not respond to the normal labor stimulation. Hindi na-stimulate yung uterus. Kaya kahit kabuanan na niya, kaya ayaw pa rin mag-labor. Kaya tumatagal. So, there are some dangers to the fetus, katulad na meconium aspiration. Because beyond 42 weeks, ang nangyayari rito is what? Yung baby, dumudumi na po siya. Naglalabas siya ng meconium. Okay, so pag nilabas niya yung meconium niya, there's a possibility na ma-ingest niya yun. Known as what? The meconium aspiration. Ano pa? Macrosomia, or yung baby na mas malaki yung size niya than the normal. Ano pa? Lack of growth. Pwede pong, what do you call this one? Lack of growth. Because placenta is functioning for only 42 to 42 weeks. Okay? So, in other words, kapag beyond 42 weeks na, ang placenta will not work anymore. So, the fetus will have what? Decreased blood perfusion, oxygen, fluid, and nutrients. So, the growth and development will be halted beyond that date. Okay, so ano po ang mga management natin dito? We can perform biophysical profile. We will evaluate the perfusion of the placenta and of course the amount of the amniotic sac or should I say the amniotic fluid. Baka nagkukulang na kasi. Okay, what else? If normal naman, we will assume miscalculation happen. Siguro nagkaroon tayo ng pagkakamali sa may pagkakalculate. Kaya nga napaka-importante ng ultrasound because in the ultrasound, pwede rin natin masabi kung ilang buwan na yung pagbubuntis or ilang linggo. Okay, so if abnormal naman ang result or physical examination or the biparietal diameter on the ultrasound result, the fetus is in term size, labor will be what? It will be induced. Okay? Kasi kailangan na nating ilabas si baby or else delikado para kay baby yung mahabang pagbubuntis. Okay? What else? How to induce the labor? There are many ways that we can use. Katulad the prostaglandin gel or the misoprostol. Okay? We have here the brand Cytotec. Discourage na po to actually. Before, nabibili mo to over the counter. Pero ngayon, no. Hindi mo na ito mabibili over the counter. Tsaka wala ng Cytotec. Okay? So, about misoprostol. Okay. Pero hindi ito mabibili basta-basta sa mga butika. You need a prescription from an OB. Okay, so, ang ginagawa din dito, we are applying that to the vagina to initiate the uterine contraction. And then, if not enough, actually, hindi talaga enough yan, sinasama natin yan na oxytocin. Okay, so if oxytocin is ineffective, CCS na natin ang pasyente natin because kailangan na talagang ilabas si baby. So, there are some nursing considerations na pwede nating gawin, katulad ng monitor natin ang fetal heart rate. Tsaka ang vital signs ni mother. Baka nagkakaroon tayo ng problema, hindi lamang kay fetus but also kay mother. Okay, then after birth, assess na natin si newborn for what? Meconium aspiration. Baka meron siya na-aspirate na meconium. Kaya aspirate natin yung bibig. And of course, we have to establish and maintain the patent airway. Okay ba? Kasi because of the aspiration of the meconium, nagkaroon ng blockage. Nahirapang huminga si baby. Okay, so assess din natin for the polycythemia. Okay, because it can happen due to the decrease in the oxygenation in the final weeks. Since nahihirapan na yung placenta to work properly, there's a possibility for the polycythemia. Okay, ano pa? Hematocrit. Kailangan i-check din natin because there's a possibility for the increase or elevated dahil nga nagkaroon tayo ng polycythemia here. Okay? What else? Pwede rin nagkaroon ng dehydration that leads to what? Lowered circulating plasma level kay baby. Ano pa? Assess din natin for the hypoglycemia kasi may possibility na bumaba ang blood sugar ni baby dahil nga wala na siyang nare-receive na what do you call this one? Nutrients or should I say sugar coming from the mother. Okay, so because fetus had to use the stores of the glycogen for the nourishment in the final weeks of the intrauterine life. Okay, so nagkakaroon tayo dito ng gluconeogenesis o gumagawa ng panibagong glucose si baby. And we also have to maintain an adequate temperature. Yan, ginagawa naman natin yan doon sa may NICU. Kasi there's a possibility na ginawin si baby pagkalabas niyan. Okay, well, what else? Follow-up care until at least school age to track the developmental abilities. Okay, i-measure din natin, okay ba ang developmental tasks or should I say developmental changes kay baby? Wala bang pagbabago? Okay, what else? Care of the woman naman, we have to allow woman to stay a longer period of time doon sa kanyang baby. Okay, napaka-importante na ito. Okay, here in the Philippines, we encourage this one na pagkalabas ni baby, padidiin na kagad si baby. Kaya tinatawag natin na unang yakap. Okay, as much as possible, pagtagalin natin yung bonding nila pagkalabas. What else? Next one, we have the preterm labor. Ayan, tapos na pala tayo for the postterm. Now, preterm labor. Okay, so the labor that occurs before the end of week 37. Before the week of 37 of gestation. Okay, so hindi pa kabuanan ni baby, lumabas na agad. Okay, hindi pa niya kabuanan, lumabas ni baby. Sir, kaya po ba niya mag-survive? Well, depende po yan kung nasa may age of viability na sa baby. Okay, so there are many danger signs katulad ng infant is what? Immature. Okay, pero marami namang makilalang ganito nagkaroon ng preterm labor pero normal naman po yung naging baby. Okay, normal yung naging baby. Kasi nga, nakaabot naman sila dun sa may tinatawag nating age of viability or the viable age. The viable. Okay. So, assessment, any pregnant woman having a persistent uterine contraction, check natin yan. Okay, hindi pa dapat nagko-contract pero nagko-contract na. Okay, if that is the case, meron tayo bibigyan dyan ng gamot. I'm going to explain that later. What else? Check din natin for the cervix. Baka nagkakaroon ng pagnipis or tinatawag nating cervical effacement. Or worse, kapag ka nagda-dilate na. Okay, napag-usapan naman natin ito last time sa naging discussion natin that there's really a possibility na bumuka yung cervix lalo na kapag ka incompetent yan. So, measures on how to prevent the preterm labor. Number 1, i-advise natin ng women to have a bed rest. Bed rest lang muna, tapos bangon lamang siya kapag ka mag-CCR siya. Okay? What else? Drink 8 to 10 glasses of fluid every day. Okay? Hindi po pwedeng ma-dehydrate ang pasyente natin dito because the dehydration can also induce labor. Okay? Kaya kailangan well-hydrated ang ating pasyente. And keep mentally active. By doing what? By reading books, okay? By watching some movies para ma-prevent natin yung boredom. And avoid also natin yung mga activities that may stimulate labor. Katulad ng pagwawalis, pag-uuro, as much as possible, di ba nga, bed rest si patient. Okay? Ano pa? Okay, consult your primary caregiver whether sexual relation should be restricted or no. O pwede pa ba ang makipag-sex during pregnancy or no? Lalo na kapag ang pasyente natin is at risk for the preterm labor. Okay, dapat talaga i-restrict yan. What else? If there are some signs of a ruptured membrane, kaya naman merong vaginal bleeding, report ka agad yan sa ating healthcare provider. Okay, report signs of the UTI because UTI or vaginal infection, it can cause some problems sa may dadaanan ni baby and it can also induce the preterm labor. Okay, what else? Keep appointments for the prenatal care. Napaka-importante na to. Okay, hindi po pwede na hindi. Kailangan nagbibisit ka talaga, nagpi-prenatal check-up ka. Kailangan nakikita ka ng OB mo. And of course, empty the bladder to prevent pressure on the uterus. Nang sa ganun, hindi madikdik pababa, papunta rin sa may cervix yung baby. Okay, by doing that kasi, mag-i-induce yung labor. Okay, lie down on your left or right side to encourage blood return to the fetus para matulungan natin yung baby. Some signs and symptoms, persistent, dull, and low back ache. Hindi po yan normal. What else? Vaginal spotting. Pagka nakita mo na meron ng vaginal spotting, delikado na to. Napag-usapan naman natin to last time na it can be a sign. Okay, it can be a sign of impending doom. Pwedeng magkaroon tayo rito ng miscarriage. Okay, what else? Feeling of pelvic pressure, parang merong dinidikdik dun sa may pelvis mo or binabagsak. Abdominal tightening, okay, it's because of the contraction. And menstrual-like cramping, parang may masakit. Okay, yung sakit niya is parang sa may menstruation. Increased vaginal discharge, pwedeng blood or pwede rin naman liquid lamang. Transparent. Okay, medyo delikado rin yun. Uterine contractions, ito napakadelikado na ito because possible magkaroon na ng labor dito. And of course, intestinal cramping. Okay, so these are some of the signs and symptoms na dapat tignan natin sa may pasyente natin. So ang diagnosis natin dito, we have to analyze the changes in the length of the cervix by ultrasound. Napaka-importante na itong ultrasound. Ito talagang magko-confirm, okay, dun sa ating pasyente, dun sa nararamdaman niya. What else? Analysis of the vaginal mucus, as you can see in this picture. Okay, hanapin natin dito yung tinatawag natin fetal fibrinolactin. Okay, that is actually a protein produced by the trophoblast cells. So yun yung sinesearch natin dito. So kapag ka-present yan doon sa atin tuloy, no? If it is present in your vagina, okay, preterm labor might occur. Okay, because labor will not occur if the protein is absent for at least 14 days. So kapag ka ganito nakita ninyo, okay, so that is what? Flag na yan, red flag na po yan. So, some therapeutic management na pwede natin gamitin. Okay, medical attempts can be made to stop the preterm labor. Pwede po yan. Okay, pero, okay, if the fetal membranes have not ruptured, pag hindi pa pumuputok yung panubigan, pwede natin i-delay ang labor. Pero once na pumutok na yan, katulad ng sabi ko sa inyo kanina, once na pumutok na kasi ang panubigan, that is the point of no return. Dire-diretso na yan. Ano pa? No fetal distress. Okay, hindi nahirapan ng baby. No evidence of bleeding. Wala rin pagdurugo, meaning to say, walang miscarriage na magaganap. Cervix is not dilated more than 4 to 5 cm. So, pwede pa natin i-stop ang labor. Okay, medyo pa lang yan. Maliit pa lamang yung dilation. So, hindi mo pa masyado makikita yung bunbunan ng bata dyan. And of course, effacement is not more than 50%. Okay, hindi pa masyadong manifest yung kanyang cervix. So, if that is the case, pwede po yan. If naman, ang pasyente natin is what? Okay, if in preterm labor na siya, okay, we have to admit that to the hospital na hindi po pwede na dun lamang yan sa may bahay because at any moment po pwedeng lumabas ang baby. Bed rest natin muna okay, sa may hospital to relieve pressure on the uterus and also sa may cervix. Monitor natin for any contractions. Okay, kung kinakailangan na ba talagang ilabas si baby or not yet. Baka pwede pang i-delay. IV therapy rin tayo para maging well-hydrated si mother. Okay, what else? Vaginal and cervical culture para na sa ganun makita natin for any presence of infection or should I say causative agents. Baka kasi meron. So, ang drug administration natin dito, ito sinasabi ko sa inyo, the one that can be used to, how can I say this one? Prevent or halt the labor. Pababagalin niya or i-stop niya ang pagle-labor. Okay, this is what we call the, terbutalin. This is actually a tocolytic drugs. Okay, terbutalin. When you say tocolytic drugs, those are any agents or drugs that can halt or prevent the labor. So, pwede natin itong gamitin sa pasyente natin who will undergo a preterm labor. Pero tandaan natin it depends. Okay? It depends. Okay? What else? Should I connect for this one? Okay? Ano po yung mga drugs na pwede pa natin i-ready rito? Of course, magnesium sulfate. Okay? Kailangan naka-ready rin ito. If ever na ang pasyente natin dito mag-undergo ng preeclampsia, tapos magkaroon ng eclampsia, seizure, at least we are ready. And also, we can use corticosteroid to be specific metametasone. Okay, the betametasone can actually promote formation of the lung surfactant to the baby, meaning to say, it can make the lungs of the baby mature. Okay, and of course, it will prevent respiratory distress syndrome sa baby. Okay, so I put here some uterine relaxants or mga tinatawag natin tocolytics. We have here INMT. Okay? Meaning, it's not my time. It's not my time yet for the delivery. So INMT. I stands for indomethacin, N for nifedipine, M for magnesium sulfate, and T for terbutalin. Okay, the one that I showed you, this one, terbutalin. So these are some of the medications na pwede natin gamitin or naka-ready okay, sa may delivery room. or kaya naman doon sa may OB ward. So, fetal assessment natin, if the woman is sent home, we will advise the woman to keep herself well hydrated. Wag niya kakalimutan na uminom lagi ng tubig. Okay, maintain adequate nutrition din. Hindi naman natin pagbabawal ng pagkain or any foods. Okay, what else? Maintain bed rest muna. Wag mo siyang gumawa ng anything that will induce what? Induce labor. Lahat ng mabibigat, strenuous activities. And we also have to advise the woman to have a record of what? The daily kick count. Okay, yung sipa ng bata. So, count to 10 tests of her baby's movement inside her womb. Bibilangin niya po yan. Okay? Para sa ganun, kapag tinanong ni Doc, kamusta yung daily count natin, daily kick count. So, you will tell to the doctor na, Doc, okay naman po siya. Normal naman po yung kick niya per day. Okay? What else? Labor that cannot be halted kapag ang membrane is what? Pumutok na. Pumutok na po ang panubigan. Sabi ko sa inyo, di ba? The point of no return. Wala na po ritong ayawan. Ilalabas na yung baby kasi delikado na. What else? Kung ang effacement is more than 50% na, masyado na manipis. Or kaya naman, ang dilatation is more than 3 to 4 cm. Okay, may possibility na lumabas na ang baby in that case. So, as a management, kapag ka naman ang fetus is what? Matured na, okay, pwede na siya makasurvive, we can now perform CS. Okay, this one will reduce the pressure on the fetal head and at the same time, it will reduce the possibility of subdural or the intraventricular hemorrhage from the vaginal birth. So, mas pipiliin natin ang CS na si mother. Pero kung kaya, sir, paano po kung kaya po yan ng normal delivery, vaginal delivery? Well, why not? Okay, pwede rin naman. Okay, pwede rin. It depends actually sa may OB mo. So, what to expect for the first stage of labor? Okay, medyo that is the longest stage. Okay, then the second stage of labor mo may be shorter. So, in that case, we can perform artificial rupture of the membrane. So, si OB po, tutusukin ni OB yan. Okay, tutusukin niya ni OB. Parang sa ganun, ma-prevent natin yung cord prolapse. Okay, what else? Minsan hindi na natin hinihintay na pumutok yung panubigan. Sometimes kapag pwede na talagang i-deliver, si OB na nagpuputok nun. Analgesics are administered also, but with caution. Okay, epidural anesthesia is also preferred para sa mga buntis na gusto nila painless ang delivery. So, subukan ulit natin ang galing ninyo, okay? So, the Kangaroo Care is an important method to increase intimacy and bonding between the mother and her new child in those first moments after birth. Ano po ba itong Kangaroo Care na yan? Okay? So, ang hirap sagutin if it's true or false if you are not familiar with the Kangaroo Care. Okay? Here in the Philippines, we sometimes call it as what? Okay? Unang yakap. So, yan. Paglabas ni baby, kailangan ibigay na kagad yun kay mother. Okay? Pinapadedi rin kagad. Tapos, tamang yakap. So, at birth, it is considered as premature when the child is born before. Okay? Nabanggit ko to kanina, before blank weeks of gestation. So, mamili na lang kayo rito kung saan yung tamang sagot. NICU is the abbreviation for what? Okay, NICU is actually one of the unit in the hospital. So, NICU stands for what? Okay, is it neonatal intensive care unit or newborn infant child unit or NARNIA in closest English? Letter D, no, I cannot answer. Dick. Okay, next is we have the intrauterine fetal death or the IUFD. Okay, ano po ba to? Okay, from the name itself, intrauterine fetal death. Saan namatay yung baby? Doon mismo sa may loob ng uterus. So, sir, para po pala itong misabortion. Well, actually, hindi. Okay, there are difference between the two. At ano po yun? Okay, the difference between the two is what? The point of gestation when the death occurs. Pagka kasi yan ay misabortion, the fetus dies before 20 weeks of gestation. Okay, so may pagbubuntis niya on the 20 or before the 20 weeks, kaya namatay na po yung baby. While kay fetal death naman, it occurs after 20 weeks of gestation. Namatay ang baby sa loob ng uterus after 20 weeks. And also, when the labor does not begin within 48 hours of death. So, they look the same, but ang pinagkaiba po nila rito is what? The point of gestation. Okay? The AOG. Kung kailan namatay po yung baby. So, there are some signs and symptoms na pwede natin makita rito that are almost the same with the misabortion. We have here, painless spotting. Okay, nagdurugo pero wala namang pananakit. Uterine contraction with cervical effacement and dilatations. Okay, nagkakaroon ng contractions. At the same time, merong cervical effacement o pagnipis ng cervix and also paglaki, dilatation of the cervix. Fetus is also born lifeless and emaciated. Sobrang payat. Katulad po natin nakikita niyo sa my picture. Ganyan po yung itsura. Okay? So, the diagnosis for this one is, of course, negative ang fetal movement. Kasi nga, patay na. Negative din ang fetal heartbeat. Uterine growth ceases. Hindi na po nagpa-progress yung paglaki ng tiyan ni mother. And also, the uterine size decreases. Bumababa. Okay, what else? Fetal heart movement cannot be visualized by ultrasound kasi nga, wala na pong puso dahil patay na. And also, there's a presence of the Roberts sign. Ano po ba itong Roberts sign na to? Once check in the X-ray, makikita rin na parang may gas formation dun sa may loob ng uterus. Okay? So, as a management here, we will induce the labor, okay, a combination of the misoprostol and then the oxytocin para mas mailabas talaga yung baby. Okay? Magkaroon ng labor, may labas yung namatay na bata. Okay? So, what else, sir? We will also perform blood studies katulad ng CBC, checking for the platelet para ma-confirm natin na ang pasyente natin wala pong DIC or the disseminated intravascular coagulation. Baka kasi ang problema kaya lumabas yung bata or namatay yung bata is because merong DIC yung mother. Okay? So, yeah. That concludes for the RH incompatibility. Separate po natin to, no? Separate na video ito. That concludes everything for the second week of our discussion. If you have some question, please reserve that sa may online discussion natin. Okay, that concludes everything, guys. Bye!